such a really exciting new area of research. We're a little behind,
Let me address that real quick.
so I think Gordon is going to give us our next instructions.
Go right away. All right. No need to panic. We knew that we couldn't keep a group of scientists on schedule, so we planned ahead. What we're going to do is we're going to do the panel right now, which Katie will moderate, and we're going to cut that off at 12:30. Okay. We'll do lunch 12:30 to 1:30, and we can get away with that because we arranged for a speaker not to arrive for the next session. No, we didn't arrange it, but it turned out to be brilliant. But Alan Stevens wasn't able to make it for the afternoon session, so we're picking up some slack there. So we'll still have 1 hour to lunch, and so no need to panic at all. So
Okay.
Floor is yours.
So we do have some time for questions. That's excellent. So if I could ask all the speakers from this session to come and sit up in the front. That way we can address some questions from the audience.
I've got my own. Mm-hmm. Oh, good.
Hey, Johnny, to join us because she didn't get a chance to answer very many questions. So we'll have the group here. And I think I'll stand up here by the mic and I can see everybody. So we do have some microphones. So if you have a question, you can come to the center or raise your hand and we'll reach you. Are you going to move the microphone around?
Yes,
somebody.
There's also microphones on the side of the room, so.
Okay, we've got somebody right here with a question.
Lita, I'm going to address the first question to you. Would you comment a little bit on the magnitude of research around the microbiome today? And if you have any specific recommendations for those people particularly interested in nutrition for the elderly in terms of research directions?
Well, I did try to offer one little hint about a research direction that as we get a little more scientific in how we classify our foods beyond just, fat, protein, and so on, we start looking at the components in foods that have particular physiological function. I try to offer prebiotics as one example. The microbiome community, because they realize that microbes are targeting particular components of our diet, that they're really trying to advocate for the nutrition community to think about our diet in more precise or scientific terms. So that's one example. The other question was about the magnitude. The report hasn't been, so let me say this. The report hasn't been cleared yet, so I can't quote any numbers, but it was a phenomenal amount of money. The microbiome field probably formally started with the HMP, which started in 2008. And at that time, NIH was funding at about maybe a $5 million per year level. It's many times more now. So across not only NIH, but all those other federal agencies I mentioned, there's a lot of interest in, so let me just back up. Why didn't we do this kind of work before? Because we didn't have the methods. That's usually what hinders science, right? So we have what are called genome-enabled technologies, sequencing, proteomics, and so on, that allow us to look at these microbes without having to culture them in the lab first. And that completely opened up the door in terms of what we could do with these natural microbial communities. We've been doing a lot of this work in the oceans, we're doing it in the human body, so we see this kind of unifying factor. Microbes are playing a major role in our health and ecosystems on the planet, but we don't have a clear idea yet how they're doing that. So that's why you see this broad interest across the US federal government in trying to promote more microbiome research.
Okay, there are microphones on either side of the room if you want to get up and
I would just add that some of this research is going to address the way in which the microbiome actually not only is influenced by diet but has direct effects on vitamin synthesis, in the case of vitamin K, the case of folic acid, on vitamin utilization, as in the case of vitamin B12. And so I think this topic of aging and diet and nutrition certainly deserves to have a strong presence of the microbiome research.
Very exciting. We have another question here.
This question is for Dr. Campbell. In the protein studies, specifically looking at overweight and obese individuals, when they're looking at grams per kilo of weight, are they looking at their actual body weight compared to their ideal body weight, or how do they determine that?
That's a very astute question. The recommendations for protein and data that are out there on how much protein individuals eat actually is truncated at a person's the upper limit of their ideal body weight. And so actually the data that Dr. Tucker was quoting on, appropriately quoting on what the proportion of older people that are consuming an adequate or an inadequate amount of protein was based on this ideal body weight. If you take people's actual body weights, the proportion of older adults that are consuming an inadequate amount of protein goes up at least twofold. Yeah, and the challenge is, well, that's the standard versus changing the standard. There have been some projects that have looked at it both ways, and you come up with a very different picture about the urgency for revising or reassessing the needs of protein for older adults. One of the things that becomes a challenge, especially with older adults, and it was noted by someone I don't recall about losing weight. Perhaps Dr. Jensen, that when older people are already eating a lower amount of total energy, they're eating less protein, and then they go and try to restrict calories to purposefully lose weight. And then even though they may be eating enough as a percentage of calories basis for protein and think that they're within the acceptable macronutrient distribution range, they're actually below the RDA and closer to the EAR. What's the recommendation from a practical standpoint? I guess I would feed people protein on a basis of how much they actually weigh, unless there is a medical reason for them to be treated differently.
There's got to be some more questions here. Yes.
Oh, that's terrible.
This morning I was tall enough to actually reach that, but after learning how much I don't know, I've shrunk it. Ellie Hollander, Meals on Wheels America. A couple of you mentioned, by the way, great presentation, so informative, so rich in research. A couple of you mentioned sort of new findings that might inform DRIs and DRAs, and I'm just sort of wondering, how do we sort of integrate the learnings of the research that you've highlighted with as we continue to contemporize DRIs and DRAs, given what we've learned? What's the mechanism for making that happen?
Well, you know that the vitamin...
No, our question is up here. You have to push.
Here? The vitamin D observations from the IOM that we've been discussing were a second look with some really lively committee interactions. And that was because it was thought that there was new information that should affect the recommendations, and that voice still continues. But I think one of the nutrients that I would certainly urge updating is folic acid. I think the concept of dietary folate equivalence is frankly questionable. And I think the whole idea of across the board of upper levels and what are safe upper levels and how we determine those are certainly going to be a consideration, not just in the case of the elderly, but in other population groups.
I would just add that the Food and Nutrition Board certainly has interest in revisiting nutrients that warrant reevaluation. One of the challenges remains that it takes significant resources and funding to undertake such a process. And so there have been a lot of thought going into how best to undertake that, because sort of revisiting the DRIs as we knew them, where they were all reevaluated at once in a massive undertaking, unless there's dramatic changes in the funding process, is not likely to ever happen again, nor perhaps is there even reason for that, because there's a lot of nutrients where there is not new information that would necessarily warrant them being revisited. But certainly if folks have specific interest for high-profile nutrients for which there's new information, I know that the Food and Nutrition Board is certainly interested in hearing about that.
Hi, I'm Beth Burrow, and thank the panelists. I want to build on that question as someone who is actually looking to feed that vulnerable and aging population. The RDIs were predominantly based on healthy aging and weight, activity levels, but the predominance of people we feed have chronic illness. So looking at those guidelines, what should we be looking at to really best feed that population?
No, you're asking a really practical and important question,
Right.
and for good or bad, you start to balance between what are DRIs for the general population of apparently healthy individuals versus getting into medical nutrition therapy, and it gets outside the realm of a DRI per se. And that was reflected, at least in some of the considerations of those groups that I presented data on, where they distinguish between apparently healthy or people with chronic disease or people with other conditions that take it outside the general range. What has been said several times this morning is that we have to rethink what apparently healthy is for older people. And in the case of the trajectory from people, especially when they get into their middle 70s and older, we're really on uncharted waters with respect to energy balance and body composition and nutrient requirements. The RDAs at that point become the minimum in many respects, but then nutrient density becomes in my perspective, really what's most helpful for those folks.
Yeah, and I just want to say that it is so important to continue to update the DRIs, because they do provide guidance to a lot of the programs and to government requirements for meals and different things. So we really want to encourage continuing the work of the Food and Nutrition Board. But in the meantime, for those of you who are doing service and providing meals to older people, I think what we're seeing is we're not even close to meeting the current guidelines. So we just have a long way to go to continue to push the good quality foods and the nutrient density.
So, I mean, not that I necessarily have the answer to the question, but I think it emphasizes the point that was raised this morning about the nutritional needs of older people with diseases and the gap that really exists in knowledge in terms of understanding how much do the needs change depending on the type of disease, and certainly an area that needs more investigation. And we focus on healthy, but it is something that needs to be taken into account and perhaps should be part of the discussions, maybe not within the healthy, the DRIs for healthy subjects, but perhaps as part of the discussion in a separate category.
One last question? Eric?
This question is for Dr. Campbell. Based on what we know so far about protein needs and status, what do you think is the best measure, clinical measure of a person's protein status?
If I had that answer, of protein status, and the traditional clinical measures, which are very crude, of albumin or pre-albumin and the like, really are a challenge, because by the time those have been compromised, you've got, you're far along in the trajectory of illness or cachexia or whatever. One of the biggest challenges that the protein field faces is that we do not have biomarkers. Mm. And that's why we're still working with nitrogen balance and isotope kinetics. Mm-hmm. We don't have unlike many of the vitamins and some of the minerals that have tests, acute feeding tests, where you can look for things, or something like a homocysteine. We don't have that for protein, except for something that it takes a long time to do. The unfortunate answer is to look for intake, to look for, if you have serial measurements of a blood urea nitrogen, which is responsive to differences in protein intake, but it's also influenced by many other things that are affecting older people, kidney function in particular. But that's really, unfortunately, where we are. My encouragement really is to, as much as possible, to work with dietitians and other people that are experts in diet assessment to see where they are. In many respects, body weight is still going to be, and the maintenance of body weight is still going to be a primary determinant of the retention of lean tissue mass.
Okay, well, with that, I think everybody's hungry. Lunch is served out here. There's not enough room at the tables right here, but there are some more tables outside.